All right, everybody. I think we're ready to get going on session number two. We've got all our panelists up here, so it looks like we're in a good place. I'm excited for panel number two here because I think this brings a lot of great relevance to the folks that are here in Region 2. These are company, one of which is located in Blocksburg and one of which is in, I believe, Roanoke, if I have ArchiveCore correct. And yeah, I think this is a great opportunity to talk a little bit about some healthcare applications, how this is working out on public health, startups, and collaborations in the space too, because ArchiveCore and Exelaration are actually working together. So a couple of quick intros for everyone, and then I'll kick us off with a question. Dr. Lennox McNeary has been leading teams in healthcare for over 16 years and has a physical presence in, physical medicine and rehabilitation physician. She is the CEO and one of the founders of ArchiveCore. So welcome, Lennox. Dr. Keel Coleman has been active in acute medical care as an emergency medicine physician, educator, and administrator for 25 years. I believe I have this right that he's the chief medical officer now is the title there at ArchiveCore and also one of the founders for that company. And then Andrew Lindberg is from Exelaration. He is, if you're familiar with the Exelaration model, they use a mentorship practice. And so he mentors undergraduates in software development best practices and helping bridge the skills gap from the industry to the classroom. And Exelaration is focused on delivering high impact software for clients in and around agile processes that promotes quality, professionalism, and learning. So thank you to the three of you for being a part of Blocksburg 2021. And to get us started off, I'll start with Lennox and Keel. Let's talk a little bit about the inception of this idea for ArchiveCore. What was it that kind of helped you put a finger on why this might be an interesting solution? And talk to us a little bit about what your company does.
Okay, Keel, you want me to start on that? So thanks so much for having us here today, James. I loved listening to that first conversation, and I hope it's recorded so we can go back and listen again. That was really spectacular. So I think first, it probably would be helpful to explain what credentialing is, because I think, as I've learned talking with Andrew, you can have one word that you think means one thing, and in another profession, it means something entirely different. So when we talk about credentialing in healthcare, it's really this extensive background check process that all physicians and a lot of other healthcare professionals have to undergo before they can start treating patients. It typically takes about 120 days. So imagine that you sign a contract for a job, but you have no actual guarantee of employment, and you have to wait 4 months before you can actually start your new job. At some point, you're going to have to relocate to be near that new job. So what if you pick up and move your entire family, and then all of a sudden, the day before you're supposed to start work, your credentialing falls through and suddenly you have no job? It's really devastating. And we saw that happen a couple of times. And so we really wanted to figure out how to fix that process. But I really didn't know where to start when that first happened. As luck would have it, back in 2017, my best friend, who's also a physician, came to visit, and her husband teaches base jumping. And so one of his students had actually paid him in Bitcoin, I think back in 2013. So this was in 2017 when the market was starting to do this. And so we were just watching their cryptocurrency portfolio, double every couple of hours. It was really fascinating. But my only exposure at that point to blockchain, or really even Bitcoin, was Silk Road. I thought it was for terrorists and money laundering and all the nefarious things, and I didn't understand what it could really do. So she gave me my first lecture on real life uses of blockchain technology. And I always joke that if a cartoonist had been drawing out that conversation, he or she would have drawn little light bulbs over our heads, because as we talked through it, we both all of a sudden said, this is a way to solve credentialing. So then I started talking with Keel, and that was really how this process was born. Keel, do you have anything to add to that?
Yeah, my epiphany moment was actually watching my chair, who's kind of an international star in emergency medicine. And we had a meeting, and he goes, give me just a minute. And I was watching him sign this stack of papers, and I asked him, what's going on? Well, he's actually impacted thousands of learning physicians. He's like, well, I've got all this credentialing stuff to do for all these people that I've taught. Everybody's moving jobs this year for some reason. And it hit me that, it was 2017, and, the star that I admire very much was taking a quill to parchment and saying, this is really me. And I'm like, what happens to that? And he goes, well, it has to go in the mail, but then it'll go to a fax machine. Um, uh, I've been introduced to cryptocurrency actually by Lennox's husband, who's a brilliant neuroradiologist. And then I started looking really at blockchain in general. And the real moment came when I was texting with her. She was in an airport, and it was like, this could do something. And then we started putting together ideas. And then we were lucky enough to run across Andrew through the help of Victor Ionello.
Great. That brings us to a good transition. You guys are both doctors, and it sounds like you've got a base jumper in there. You've got another doctor as a husband there. But could you talk a little bit about how you became familiarized with the technology that is blockchain? And I'll bring Andrew along into the conversation here too. Talk a little bit about how you got synced up with Exelaration and kind of how Andrew has helped you understand the technology, kind of what your needs are, and how this is a potential solution for some of the problems you face.
So, as you mentioned, we have no background in this sort of technology at all. And so Victor did introduce us to Exelaration, and we were luckily paired with Andrew, who is a fantastic teacher. And I think one of Andrew's skills is, I like to think of him as a translator. He is really good at taking technology and explaining it in a way that I can understand, and also taking the vision that we have in our head and figuring out how to get it to a finished product and telling us when we've lost our minds or when we're trying to do something that's realistic. But he is so good at talking us through that. And so that is, for me, how I've learned as much. I think Keel has read probably more on his own than I have to understand blockchain, but a lot of my education has really come through Andrew. Keel, do you want to add, Andrew?
Part of this, and I think the other part of the story we needed to include here is Lennox and I are both employed at Carillion Clinic and faculty at Virginia Tech Carillion. It was really through the Carillion Innovation Initiative that we got in contact with Victor Ionello, who frankly took some of our concepts and helped us shape them into a software delivery device that then can be interpreted by somebody like Andrew. And so that meeting up with somebody who, as Lennox says accurately, it really functions as an interpreter and also a fantastic engineer who has helped us develop the product that we have today.
Yeah, so like you mentioned, Victor introduced us, and you got synced up with us with this proof of concept software that we've now been working on for, gosh, I guess it's been close to a year now, refining and improving. And the thing that really struck me about our process is as we go through that agile process of trying to learn and refine and improve the flow and the benefit that this software can bring to that credentialing industry. One of the things that I have constantly been returning to, and Lennox knows this through all of our many chats, is that I think so much of the value for blockchain, particularly in this industry, but really overall, is that its mechanism is really focused on capturing information. And so the credentialing model is such a great match for the things that blockchain enables, and building, that auditable log and that, that durable history of information. So that has kind of been a grounding, mechanism that drives, I think, as we continue to discuss and refine this project, keeps us focused on what's most relevant.
Could you talk a little bit about the decision tree that you went through as to like identifying why blockchain was the thing that made sense for this application? And I'll pose this question originally to Andrew too. Of it sounded like when we did a little bit of the prep for this session, that's something that you're kind of familiar with, is like walking through, when is this a good idea to use blockchain? When is it not a good idea to use blockchain? Because I think that is a kind of a constant question that we're hearing in some of the consultations that we're putting forward. Could you talk a little bit about how you help companies make those decisions, and also how you were able to locate this as being a good decision to use blockchain in this use case?
Sure. So Like I guess this ties into what I was just saying, is that one of the things that's relevant about blockchain is that it's very good at information, and so the reason I think we saw it take off in cryptocurrency specifically is that area of the market, like that space, is entirely centered around representation of information, right? Account balances and transfer records and things of this nature. We're not trying to do things maybe in the physical space. There's been some pushes for integrating blockchain with logistics, which is an interesting space, but I also think that there's increased risk if you try to bring blockchain and its technologies kind of out of the digital world and attach it to the physical world too closely, because you introduce another link in your process that has to marry a computer system to a physical item, and that can be a challenge that the blockchain technology isn't really going to help you with. But so again, in the credentialing space, I think it's been a great match, because the value that they are trying to represent is effectively the record of these credentials, right, which are kind of an abstract concept that is information based, and we can capture and make durable using blockchain technology that doesn't require physical representation, right? So we have a diploma. We have the idea of like a physical diploma that you would receive at the end of a educational program, or other such physical documents like the ones Keel was talking about being signed, and those are kind of the way we have historically associated, trust and information with these kind of credentials. But the truth is that the paper is not really the valuable thing. The valuable thing is really that idea that someone is vouching for someone else, right? We're capturing that idea of trust, and that linkage of trust between two people or between two institutions. And that kind of information we can capture on the blockchain entirely digitally, and not worry about the risk to paper records or the complexity of transferring them around.
Sure. And, I think that is an interesting use for that I've heard of, is the idea of possibly adding more of these kind of credentialed processes at a university degree. Is that something that either any of the three of you are aware is kind of accepting kind of broader application? Are places like Virginia Tech and other kinds of schools considering the idea of actually putting things like degrees on a blockchain?
Yeah, so it's interesting. One of the first kind of non-commercial, I guess, uses of blockchain came out of the MIT Media Labs. And their very first goal was giving certificates for accomplishment. I believe the company was Learning Machine. In the U.S., diplomas mean a little bit, transcripts mean a lot more. Where in Europe, it's all about the diploma. So you actually have, a single document that can then be hashed, and then that cryptographic record can become whatever you serve up to your employer or your next learning institution, and that's met with significant success. In the U.S., there's when you say diplomas, it's interesting that somewhere and from the hip, somewhere around 70% of all higher learning entities right now are outsourcing their diploma production, meaning, for instance, Virginia Tech actually uses an e-diploma service that is located in the Commonwealth of Virginia. If you go back to Virginia Tech and say, I need a copy of this at the office where they develop them, and they'll say, okay, well, great. It'll take a few days because it actually has to be shipped from this other place where there's an electronic record that's kept. Is it kept on a distributed ledger, a blockchain? No, not right now. Is there great utility for it? Well, I think culturally, that's not so much the case. And in medicine, it certainly isn't the case, where it comes down to what did you do during your training? What did your transcript, if you will, look like? In graduate medical education, it's all the things that you've done. Did you exercise with enough quality your practice during this year of training, and how many procedures did you do in a certain specialty. And those are all then quantified, added up, and put in a final document. But that entire stack of accomplishment is what really counts when you're talking both to credentialing verification organizations and institutions and to insurance payers. There's a little bit of a difference there from just a strict diploma. Yeah, you did this, great, you can have it on an immutable ledger forever, versus here's a giant stack of information that has to be maintained and then verified.
So it seems to me that you probably need a decent amount of a critical mass to kind of come around in terms of learning to use this type of a thing for a credential, like universities to kind of have buy-in, or if you're looking at criminal background checks, you need an amount of either states or municipalities to start to actually adopt putting this on blockchain. Could you talk a little bit about how ArchiveCore is positioning itself to be kind of ready for other people adopting this technology, and how many of those partners are necessary to help you along with this credentialing process on the blockchain?
Great question, James. So we feel like there really will be regional adoption. About 40% of trainees stay in the state where they trained. And so if we have, for instance, Carillion and VCU and UVA all on board, that really, and maybe Lewis Gale, that really captures a whole group of residents that are going to stay in this area. Right now, we are doing an expanded pilot with Carillion Clinic, and we've also are in having conversations with other hospital systems to get a little foothold in some different areas in the country, and then we're going to see where we go from there. But it's a new technology, and healthcare innovation is challenging and slow. In our previous talk, they were talking about the government and that there's not much I guess tolerance for error. Same thing in healthcare. So they really just don't want any risk to innovating. And somebody just asked a question about the security of records. That's really a huge piece. And so really being able to convince people that we're keeping the data secure is a huge hurdle for us.
Yeah, to go to a couple of the audience questions that we have going. With all of that personal information that's going into the credentialing process, how are you building up a secure process for those, not only to be within your own organization, but for those to kind of be something that interfaces with other organizations? I assume that adds quite a layer on the Andrew side, but could you talk a little bit about how you're overlaying security onto some of the work that you're doing?
So first off, we don't store the records. The records are housed at each individual institution. They own the documents. And right now, everything's sent by fax. And so our secure transfer portal actually makes that process much more secure than somebody just sending it by fax or unsecured email. I will let Andrew hit the security for the software, because that's definitely his area of expertise.
Sure. Yeah, I think you make a couple of great points to open out, which is that the focus of what we're doing in this refinement, right, is improving over an existing system, and the existing system's security process is already not great. So there's a lot of room for us to improve the situation. To the question in chat about records around that, like Keel or like Lennox mentioned, the records continue to be housed at the institution. We are providing a mechanism for transfer, which is done with all of our classic best practice industry standards for encrypted transfer and things of that nature, just like you would see at your bank or other places like that. And then the metadata that we store to manage those records is similarly stored using encryption in our database as part of the online service, which is the kind of the lookup information for the different records that continue to be managed by the institutions. On the blockchain, we are storing effectively anonymized identifiers that we can link up, but not storing, sending personal information or any private data to the blockchain itself. The blockchain provides us kind of durability and a high degree of confidence that the audit trail that we build and that the institutions build using the ArchiveCore platform is immutable and durable, so that they know that the ground isn't shifting under their feet as far as credentials are concerned. but we do not, we're not sending any of that private data to the blockchain, so it's not at risk out there on a public ledger.
So I'll take another audience question that's coming in here about how have you faced some of the challenges about standardizing and the consistency across similar businesses? I think that's related to what we've been talking about and stuff, but I assume the different hospital systems already use different systems. Is what you're proposing a kind of a unifier that might actually create some standardization? And could you see that kind of run across the nation, or is it really this regional kind of model of how this works? And I guess I'm kind of asking, how do you bring along some of the partners that may not be under your own roof?
Keel, that's your bailiwick.
So the processes for credentialing specifically are fairly consistent across different healthcare systems. There are accrediting agencies that surveil these processes very closely. So there is already some embedded consistency from place to place, institution to institution, across states and across the nation, with the ultimate arbiter being payer mix, Medicare being a large part of that. So you have this umbrella of where the money comes. They have these standards that you must function within. Of course, then you subdivide down to different health systems and even individual facilities within those health systems, each of which has an individual ID number. And they all believe that they have their own proprietary needs. So an example of when you say the differences between places and the lack of consistency would be just the general demographic sheet. Every single hospital, I mean, every hospital, not just health system, has their own unique sheet that they need filled out. That's an obvious place where standardization could help a great deal. Because what we see on the receiver end is either the administrative assistant, what we call a program manager in residencies, or the physician themselves have to put down the same data, just in different formats on a bunch of different sheets. We have an opportunity, I think, with this standardization of how credentialing is verified, to provide a platform where the forms that come out that all have the same data, they're just in a different order perhaps, and a different header on top. If those were all made consistent. And there's a significant drive, not just from private enterprise like ArchiveCore, but from groups like the American Association of American Colleges, of Medical Colleges, and the AMA, who are all saying this really, we really don't all have unique forms here, and it's not special that you've got this header. We can do this better by being more consistent. And I think that we're standing right on the threshold of that. We'll then see processes that look much more similar between different hospitals and different institutions.
All right. So pulling back a little bit from the healthcare aspects of this and just talking about you guys as a company, a lot of the people here on the call right now are people who are either in businesses that are kind of considering blockchain or might be, considering a startup for that. Could you talk a little bit about some of the decisions that you made early that you felt like were good decisions? Maybe partnering with Andrew might be one of those. I could imagine that might be one of them. But some of the things that you did early on in the inception of the idea and thinking about how this technology might work that were successful. And if you feel okay about pulling kind of the curtain back a bit, could you maybe speak to some of the things that maybe didn't go well, or some of the advice that you might have for those who are considering this, of maybe some mistakes or some things that were initial struggles?
I'll hop in while Keel's thinking. So I think a couple of our early good decisions, partnering with Carillion Clinic has been incredibly helpful. They have a robust innovation program, and they have given us really incredible access to graduate medical education and the credentialing office, who are really our end users. And so we've been able to do customer discovery and really get fantastic feedback from those groups. So I think the support from Carillion has been really key for us. Partnering with Andrew is a no-brainer as in terms of one of our best decisions we've made. As new entrepreneurs, I have a list about that long of things I wish we'd done differently. We're learning as we go along, but I think the partnerships we've made with Carillion and with Andrew have been two of our good choices. Keel, what else do you have to add?
Yeah, I totally agree on everything you just said. The Carillion proof of concept program through their innovation initiative was great. I think also the access to advising. This is an interesting enterprise because neither Lennox or I have a professional background in this world, and we needed significant assistance. And that was not only on the technical end, but also on the business end. My business degree is really in healthcare processes and not so much on the tech or the entrepreneurial side. So I think that if you're coming into, especially the medical world, partnership with a known healthcare entity is critical to your success. And the unsolicited advice there would be, know what you need out of them and know what they are as frankly, your customer. Having that, there's something very early said in the last session that I thought was really sage advice. And that is making constant rechecks with the stakeholders, especially in a big health institution that is by its nature incredibly conservative. This is all necessary, so the change is necessary. It's also terrifying to the conservative culture that is American medicine. I think the second thing, though, is having someone who knows both sides of the equation a little bit better than you do. And that would be the business entrepreneurial side, as well as the tech end, where you might not have the knowledge strength that you need for success.
One of the things that I think that you guys have done a great job with over the course of working with you for the last year is that you are so unafraid to, just gather all of that information, like you said, checking in with the stakeholders. We've had lots of conversations, and you are constantly willing to, kind of re-synthesize and re-examine your goals and your trajectory with new information and make changes and pivot where you need to, not get too beholden to that initial plan as part of that agile learning process. And I think you guys have done a great job of that.
Thanks, Andrew. I think one other plug for at least for the Virginia companies, we were lucky enough to be involved in the Lighthouse Labs Accelerator based in Richmond in the fall. And as Keel talked about mentorship, that was an unbelievable experience. Could not be happier with how much we grew during that time period. And then there's also 757 Accelerate, which is based out of Norfolk area. And we're actually working with another accelerator down in Charlotte, RevTech Labs, which has been, they're more fintech and insurtech, but again, another exposure to a tremendous network of resources. And so I think looking for groups like that wherever you are is a way to grow really fast and have fantastic support.
Great. Well, again, this is kind of changing some gears to ask a broader question about the future of blockchain within healthcare. I'm kind of keying on one of the things that Keel just said there of this is a conservative space. Healthcare is definitely dealing with people's lives, their information that really does have some very serious privacy concerns. And so the question that kind of comes from is, where do you see the future of blockchain in healthcare heading? And, what do you kind of see as the future of this technology within that space? And I'm asking that very broadly. I think is this something that really is a silver bullet that offers this trustless system, or is this something that is an overwhelming kind of hill to climb?
Okay, so not a silver bullet. I can't really use a firearms analogy. What we're working on is really incremental improvement in a process that's been screaming for improvement for 4 decades, really low hanging fruit. The good use of blockchain because it shows origin or provenance, and then you can always audit. You can always go back and it's mutable. It also has no data on it that could injure someone. A nefarious actor could access our database and there'd be a whole lot of cryptography, but really nothing that says anything about an individual person. I think that the big challenge going forward, especially with some of the laws that took effect this year, now you can actually access your whole medical record. I don't know how many people on this call know that, but that's brand new. And again, everybody in healthcare is terrified about it, but it's things that are in charts that you come right up against privacy. How is that being housed, and how long is it going to last? HIPAA has portability in its name. And right now, we don't really have any method for healthcare information portability. That is on the horizon. Is blockchain going to be the answer for that? I think it's going to be part of the answer. I think that we're going to see big movements around like quantum key distribution. This will have to be like, quantum security that can last 100 years instead of 20 to 30. But that's a horizon change. I see blockchain being used in really administrative improvements in healthcare, which, depending who you read, it's somewhere between 12 and 30% of what we spend in our healthcare dollar. And anything that we can make it more efficient in that space is a win. So not a silver bullet, but a really powerful BB, if you will, that could help us move to a place where healthcare is more equitable and frankly, more affordable. I think there's an opportunity for crypto land in general to increase equity around, for instance, savings accounts. I mean, our healthcare insurance infrastructure is just redunculous when you look at the rest of the world. It's really, frankly, depressing from where I sit. And when I talk to people in our area that frankly can't afford to get the care they need. And when you approach them with a health insurance plan that says this will cover your family, and yet it's still what they're going to be paying out of pocket equals 25 to 40% of their gross income in the year. This has got to change, and we've got to find a way where people can afford their care. And I think there are some novel opportunities out there, especially in DeFi, where people could actually hang on to the money they make, but have a shelter where they can pay for the health care that they or their family might require. That's a little bit of downstream thinking, but I think we'll start seeing projects like that, hopefully in the next 24 months.
Okay, so one of the other things that I think is that you keyed on there was that you had a problem and you looked for some potential solutions, and blockchain offered, one of the tools in the toolbox, and we're able to use that. So this question is going to Andrew, but I certainly would be interested in Keel and Lennox, any opinions you have. But could you talk about the importance of kind of needing that problem as opposed to using blockchain as a solution that can be that kind of silver bullet? And Andrew, could you maybe key on some of the ways that needing that problem is kind of where, I don't know, the process starts, and also how you've helped kind of navigate businesses towards blockchain or maybe another solution, just because it's not the right hammer and you aren't necessarily looking for nails. You may need a wrench or something like that.
Yeah, it's really interesting. Especially recently, blockchain's getting so much press, increasingly with all the valuation that's happening in the space of various cryptocurrencies, this recent interest in non-fungible tokens, and some of the attention that's now being paid to the like economic energy environmental impact of the cost of managing some of these distributed systems in the way that they're currently architected. And some of that is also changing, but I think that's very true, is that it's a new novel piece of technology, but that doesn't necessarily make it the solution to every problem that exists in the world right now, or every problem that will exist. Technology as a space generally is constantly running that risk. I'll pull back the curtain a little bit, which is to say that the technology space in general has a occasionally unhealthy interest in the latest innovation, and that usually doesn't have a huge outsized impact on the rest of the world generally, because it's developers being tasked or being asked to develop similar platforms or similar services, kind of, nothing is new under the sun, so to speak, with new technology platforms that have come into existence. As the popularity of different languages or different technologies rise and fall, we see, the reimplementation, we see centralization, we see decentralization, we see re-centralization. There's this kind of ebb and flow, and there's a little bit of chasing the new thing. Blockchain stands a little bit uniquely in that place, in that it has such a potential reach outside of the technology industry. Like, it doesn't impact just developers just because of its, kind of raw energy costs to some degree. Some of the networks I've seen quoted, consuming the energy usage of small countries just to run some decentralized networks. And so that's starting to change and starting to be paid a little bit more attention. But I think it's super relevant that we don't, necessarily try and force every problem into this mold. We have, several decades now of history of understanding of computing, and we, need to continue to be better and better and better about paying attention to the lessons that we've learned in the past and not constantly reinventing the wheel. So that is a very real risk. I think that there are really interesting problems that blockchain can help solve. Bitcoin is probably a good example in the context of a space where it makes sense relative to what we talked about earlier of identifying a space where the digital nature and the immutable nature of blockchain's kind of promise, like its ability to provide a new solution, is interesting because it's not tied to anything physical. In general, we are, as technologists, trying to, predominantly, most of technology probably goes to improving existing processes, right? Automation and streamlining of things that used to be slow in the physical world. We can leverage digital tools or automation or like even, going down all the way down the road to things like robots, right? On the factory floor, we're just increasing the capability of the system with technology. And there are not very many innovations like blockchain that kind of open an entirely new world of access that kind of really fundamentally changes the game of like, okay, how does currency work? Where we move from this idea of reputational trust in banks and government fiat to trust in a technology protocol that uses a lot of complicated math to kind of ensure and strive toward equity among all actors. So it's an interesting space in that way. But like you said, it's not always relevant. And so we do have to carefully play that game of understanding, what problem is it that we have and what is the correct technology tool? Not just because of popularity, but because, we can actually talk about the fundamentals of a particular technology topic that we might elect as a solution and understand how well it's matched to this problem that we're addressing. So I think, the problem is super important. It's always relevant to start, with our problem rather than taking our hammer and going around looking for things to hit.
So a couple of audience questions have come in here. One is about the actual quality of health. Keel, you kind of touched on this a bit, but are you starting to see some applications of blockchain-based companies that are looking at the actual customer or the personal or the individual that are looking at ways to improve health? And I guess we kind of could link the two questions in some ways of how are you starting to see those systems work with the existing systems that healthcare systems rely upon, and how's interoperability kind of being accomplished in that space? I know it's a little bit outside of your specific domain, but as a doctor, are you starting to see some companies emerge that are creating some useful and distinctive applications of blockchain that might help personal health?
Yeah, it's a fascinating evolution and a great question. Thank you. I think that was Peter. So first off, does technology improve health? No. And I guess we're done. No. So does technology on its own? No, it has to have that human interface. For instance, my Fitbit which is, I think, nestled in my bedside table right now, is not doing me a lot of good right now. It has to have that interaction. It has to have the feedback of, okay, I've exercised this much, or I'm sleeping this good, or whatever. It's interesting. I am doing a lecture series next month in our residency about social disparities, and part of that is where we look at, okay, what actually makes health, and it's always stunning, I think, to medical students when 40% of health is, well, how are you born, and where, what is your zip code? That comes next. How well are you eating? What does the environment look like education-wise? And then how do you maintain yourself as a growing human? Health care impacts health or wellness today, I guess would be the going phrase, about to a degree of about 10%. So 90% of our health is completely outside of healthcare. Now, when you think about that chunk that comes from that individual and how they own their own responsibility for their health, signaling, whether it's interpretation of information you get from healthcare providers or from literature that you read, or from, say, a wearable device, how you use that, I think, has a direct impact on health. And yes, we are seeing that. I have patients. In my very last shift a couple of days ago, I had a guy tell me, hey, my heart is beating funny. I know because my Apple Watch told me so. And we actually went back in his watch and he made the diagnosis for me of his new dysrhythmia. And we gave him the correct pharmaceuticals. And frankly, he avoided a hospitalization because of it. We were able to nail all that down during an emergency medicine visit and get him lined up with a cardiologist, and all worked well. I wish it always worked that way, but it doesn't. There's also the pain of, oh, I have my last 2 years of Fitbit data where I have variations in my heart rate. Am I now responsible for that as the medical professional that's interacting with you? Is that now my data that I'm having to interact with as I try to help you out? These are all questions that are evolving still, and we don't have all the answers yet. I think there are places where technology can definitely help, especially in a public health arena. And I'm thinking about, gentleman before, I believe it was Jose, was talking about vaccine passports. And I know there's the political hot button of it. But if we take all of that away and say, okay, public health wise, you've got an infectious entity in your midst, a group of people selected or elected to get a vaccination, and we can say that there's a 95% chance that they have gotten immunity, or they are immune 95% of the time when confronted with the disease. Can we protect the public by having a record? I think the big question there is who owns that then? And I think that's the peril of having third-party apps. I think that we have to be very, very careful about who we give this information to. And if you're an enterprise and you see health only as commodity, perhaps philosophically, and then actually, that probably is not the best for the individual or for the community at large. So you have to have something that has a database. I'm thinking about a Department of Health, for instance, the Virginia Department of Health perhaps has their database of who's received vaccinations, and that's where it lives. Now you need proof of that. And yeah, your paper card from the CDC is not going to get it for long. So there has to be some record, some, if you will, credential that says this is verified. And where does it live? Well, living on a blockchain would be a very obvious fix to me. So you need something like a QR code. You need something that is totally outside of a third party. It's you interacting with the delivering agency, Virginia Department of Health. And then that has to have equity to it, meaning just like the government has provided vaccinations for an entire country, which, by the way, is the miracle of our adulthood, I think. But that information also has to belong to everyone, each individual's information. They need to be able to have access to it. So how do you do that? When you're looking at some way to create a profit, there's going to be some administrative costs, and who absorbs that has yet to be seen. I think that's the model that we're going to work with, and that's a place that technology can definitely make an impact, both on an individual's health and in the public health continuum in our community, state, region, and hopefully country. By the way, if anybody is on the BDH, we actually have that platform sketched out. So it's a perfect credentialing use. Does that answer the question, James?
Yeah, I think so. Lennox, did you have something to add too?
Sorry, my screen just zoomed off. I think just, going back to the question about efficiency, I think that's one of the places where we always worry when we hear value in healthcare. Value doesn't always equal quality. Efficiency doesn't always equal quality. But one of the things we've really focused on is how does efficiency give people the opportunity to spend time on the things that matter. So as a physician, I have no problem staying until midnight to take care of a patient. I'm not a huge fan of staying at work till midnight to fill out credentialing paperwork or FMLA paperwork or whatever it is that I'm doing that's administrative. So being able to make any process in healthcare more efficient so that as a physician, I can spend more time with my patients. As a credentialing specialist, they can spend more time with their eyes really on those records and find those red flags sooner. If we're talking about billing and things like that, anything that allows people to use their time more efficiently saves healthcare systems money, but it allows us to do our jobs better. So I think the question about the focus on quality of care is really important. And I think efficiency with the purpose of allowing us to provide better care is really important. And I second everything Keel says about social determinants of health and really figuring out how we can harness technology to really improve each of those measures for our community.
Yeah, I think taking the kind of administrative practices off of doctors' backs is really one of the things that's great about ArchiveCore is the idea of having a little bit more fluidity and the ability for a doctor to be hired. It's certainly something I think I got it when we first started interacting most when you kind of heard about nurses and doctors that were kind of moving across the country to go into some of the targeted hotspots for COVID and things like that. I mean, I think that is an incredible use case for something like ArchiveCore to be able to get a doctor on board quickly, know that they're somebody who's credentialed, somebody that doesn't have any kind of weird things in their past. And I think that that's a really an incredible thing. And I think that it's probably an easier application of blockchain and technology in the space is how do we get paperwork and the credentialing and these kind of our bureaucratic processes off of people's backs and get them to be able to be focused on people's health. So anything to add here? I think we're actually at time, but I want to give you the space to add any last thoughts if you have any.
I just wanted to mention something that was interesting to me that Keel brought up about HIPAA and the idea of portability. So there are some ideas that have been building around blockchain technology and the idea of sovereign identity, meaning that we can look at ways to build systems where an individual has control over their data and can leverage it through public blockchain transactions while protecting the data itself, but granting access on an as-needed basis to different organizations with expiry and asserting some control over the way that their data is used and shared. And that could be really relevant for the medical space generally, like you mentioned around the idea that a patient needs some access to their own medical records, but also needs the ability to share them where appropriate without having to rely maybe on these organizations coordinating. Kind of taking some control over that back could be a very interesting and powerful piece of the puzzle.
Great. Well, with that, I want to thank the three panelists from this session, Keel, Lennox, and Andrew. This is a great discussion, and certainly I wish everyone the best with your companies individually, and all the best of success for you guys. But thank you so much for being a part of Blocksburg 2021. A couple of administrative quick things. We're going to be taking a quick break. For those that have gotten on the call here recently, this call actually stays going the entire 4 hours. So just stay here and we'll be kicking back off at 11 a.m. And one quick note, I'm actually not going to be hosting the next session. That's going to be falling to Tim Abbott, who's one of our steering committee members and a speaker at Blocksburg 2029. And our next session is with Colonel James Allen Rigener, who's going to be talking a little bit about Veritex, his company, and some of the ways that decentralized manufacturing and DeFi are changing the way that blockchain is used by companies. So definitely an exciting discussion, and we'll see you back here at 11 o'clock.